All attendees are in listen-only mode.
Hello, welcome to the PracticeAdmin ICD-10 webinar series. This is the first in our series. We're going to give people a minute to join us and then we'll get started. Okay, let's get this show started. Again, welcome to the PracticeAdmin ICD-10 webinar series. This is the first in our series of 5 webinars this month, weekly on Wednesdays. I have posted on the screen here our webinar lineup, and you can go to PracticeAdmin, our website, and register for each of these webinars. The first one is today. It's an open forum. We have questions from our customers, and some of you who have sent these questions will answer. And you can also submit your questions in the GoToWebinar question box. So very quickly, the other webinars, we have September 9th, How Do You Know If You're Ready for ICD-10 with Kathy Dyson. September 16th is your EHR and ICD-10 roadblock. And September 23rd, Preparing for ICD-10 and the Value of Custom Training. And then again, we'll have another open forum session on September 30th. Let's welcome our speakers. Oops, sorry. Oops. Hold on, I don't know why I did that. All right, Eric, you on there?
I'm here, Tamara.
Okay, so welcome to Eric Chris, the CEO of PracticeAdmin, who has lots of experience in the healthcare industry and has spoken at industry orgs about ICD-10. And Kendra, are you there?
Yes, I am.
Great. Welcome, Kendra. Kendra is our EDI specialist here at PracticeAdmin and has an extensive background with managing our EDI and claims and a billing services background. Thank you for joining us today. I know we've all been getting questions about ICD-10 from our customers. So today, briefly again, we have some questions that have been submitted, and we'll address those today. People can also enter questions in the GoToWebinar question box. And if we can't answer it, we'll try to find the answer and get back to you. And a reminder that we'll have another open forum session September 30th. So let's get started. Okay, Eric, can you briefly remind us why we're all here today and talking about ICD-10? What is it and why is it important?
Sure. Thanks, Tamara, and welcome everybody to the call. And hopefully what I'm about to say is not news to you, but on October 1st, we're moving to a new code set for capturing or recording the diagnosis for a patient encounter. We currently in the U.S. use ICD, the International Classification for Disease, version 9. And on October 1st, Medicare has mandated that all claims sent to them with dates of service after October 1st use the ICD-10 version of the code sets. And of course, when Medicare mandates something, that means many other payers jump on that same bandwagon, but not necessarily all payers, and we'll talk about that a little bit later. So ICD-10, a new version, and it's not new in the sense that the first release of ICD-10 actually dates back to 1992, and the United States is one of the last developed countries to adopt ICD-10. We've stuck with ICD-9 longer than almost anybody else out there. And the biggest difference that people talk about with ICD-10 is the increase in the number of codes. And why is that? And that's because the primary difference or the primary change that was made with ICD-10 was to allow diagnoses to be categorized much more specifically. And so when you do that, you have all these additional, as you see there in the bottom right, so what family, what section it is, what body system does this diagnosis relate to, what body part does it relate to. And so you can now put all that additional degree of granularity into the code. And so if you did that for every possible code, there are up to 150,000 codes, but that's if every possible combination was used. And will every possible combination be used? Don't know. You know, you often see these websites with lists of silly ICD-10 codes, things like burn injury sustained while water skiing. Well, and why does that code exist? Well, because there's a code for burn injury, and there's a code where you can say it happened while they were water skiing. Now, could that happen? I guess if you're one of those folks who works at Cypress Gardens and you jump through the flaming ring on the water ski show, I guess you could sustain a burn injury. But I think the average practice is not going to see that particular combination of events and aren't going to have that code memorized as they go forward. But since coding touches the entire sort of revenue life cycle, obviously the patient comes in, has an encounter with the provider, you select a diagnosis that's relevant to the procedures that you performed during that encounter. That diagnosis gets included on the claim form. The claim form gets submitted to the payer adjudicates the claim, and then they pay or don't pay based on that. I think one thing I'm going to say, and maybe it sounds a little crazy for me to say it, from the billing software perspective, and that's obviously what PracticeAdmin does for our customers who are listening, and if you're someone who's not a customer but are considering becoming one, welcome to the call as well. This isn't a major change for us, but it is. And so how can I have both those thoughts at once? Let me explain that. So what our software has been doing for the last 15 years is allowing you to create a claim, enter patient demographics, enter one or more diagnoses, enter one or more CPT codes, and then submit that claim. So after October 1st, none of that changes. You still create a claim.
Same process.
Same process. You'll still select a patient. You still select one or more diagnoses, and you still one or more CPT codes, and you hit submit. So what's changing, and it did take a lot of work on our side and all the various systems involved in this chain, we had to update the select a code process to allow you to select an ICD-10 code. And because the structure of the codes is different, we had to do a lot of work to make sure that fit into the system, as well as we built in some tools to try to help you find the codes more easily. But on the overall scheme of things, from our software perspective, since we don't do coding in our software, you enter a code, but we don't, we don't do in our software chart reviews. We don't have assisted coding. That's being done on the EMR side or by specialized coding software or by a coder either in the practice or on an outsourced basis. They're the ones who are obviously having to learn all these new codes. When it comes to the billing side, you're just making sure that if it's a date of service after October 1st for a payer who wants ICD-10 codes, that's what you're choosing. So
right.
It's a major change, but it's not.
So process, right?
Right.
And a quick reminder for those who don't realize you don't have to learn all the new codes for your practice or your specialty. You just need to learn the codes, maybe the top 20 codes that you're using, create a cheat sheet. Now we're going to move on to the value.
Sure.
A little bit
and
more.
That's certainly something we recommend, and let's talk about that. So one potential benefit, so let's lead with a benefit, is that potentially higher reimbursements. And how can that be if we're just changing the diagnosis codes? Well, because, and this is not PracticeAdmin saying this is what we've heard from industry experts talking about this, is that because the ICD-10 allows you to have greater specificity, get down to very, very detailed things and explain essentially or provide more background about the diagnosis, you can then use that as a justification for more complex procedures. And more complex procedures generally mean a higher reimbursement rate.
Right. And so let's you want to go over a couple of these?
Yeah, so you don't need to learn every code.
Right.
Right, as Tamara mentioned. So one of the things we certainly recommend, although we're not a medical practice, but when our practice customers or billing company customers call us, what can they do to get ready? One of the things is obviously just focus on the codes that are relevant to your specialty, to your practice, and we would certainly recommend starting now, right? Go get a list of your top 20 diagnosis codes. Go look at your encounter forms that already have diagnosis codes on there and in ICD-9, and make sure you've identified using various tools, one of which we have in our product, but there are lots of, obviously, printed books, online resources. There are consultants who will help you figure out which ICD-10 code is most appropriate for that ICD-9 code. Unfortunately, it's not a one-to-one solution because the 10 is such a major structural change in the format of the code. It's not a one-to-one map like this code because some codes that are in 9 are a single code become multiple codes in 10, multiple things you could choose from, and the reverse is true. Some things that were multiple codes in ICD-9 become a single code in 10, make it a little more complex. Of course, if your software like ours is ICD-10 ready, this should help you streamline the conversion process, and we'll take a look at what's in the PracticeAdmin software now in just a little bit. And then another benefit and the overall reason, people say, why are we having to make this change? Why is this going on? The policymakers, so people who set healthcare policy, work on healthcare policy, where this all came from is that because of that additional level of detail, that additional granularity, it allows them to analyze the data in more detail and come up with recommendations and initiatives to try to improve the healthcare in the United States. And so they're looking forward to being able to have this, that if you're having burn injuries and a huge percentage are happening from water skiing, maybe we need to have an initiative at the state or the federal government level to try to, stamp out this pandemic of water skiing burn injuries. And that's, of course, a silly example. But perhaps more practical is you can now specify where a fall took place in the home and how severe the fall was, and then to use that data to figure out, gosh, if we just spent some money on improving or changing standards for mobile home bathrooms,
oh my gosh,
and having a non-slip floor or something, maybe if we mandated that, we could see this much change in fall incidents in the United States, and then save that much, have that reduction in cost. So that's the overall goal.
An incredible amount of data will be coming in. It'll also help with trending and population trending. We need to go ahead. We've got questions coming in.
Sure.
So let's dive into briefly. We wanted to overview PracticeAdmin, and are we ready, and how will our customers be able to see it in the product and use it?
Sure. And so what we've done is, so if you're a user who's been in our product, and you specifically in the billing manager module where you create new claims, so now on the claim details screen at the top, it didn't used to say ICD-9 or 10 because it was always ICD-9. Since May, there's a radio button that says ICD-10. So when you open up a claim, it defaults to 9, but you can now click the ICD-10 button and change that to 10. And what that does is that then it switches the drop-down list, the choices for filling in the diagnoses from the 9 code set to the 10 code set. Both are in there, and you can use whichever one is appropriate for the claim. And so, for example, if you were looking for unspecified typhoid fever, A01.00 in ICD-10 talk, you can either type that in, or you can use the drop-down list. You can use the type ahead function. So, but you can also, we also created or integrated a lookup tool called GEMS. GEM stands for General Equivalency Mappings. This is a tool developed by the Centers for Medicare and Medicaid Services, and what this does is they did essentially their best guess. What's the general equivalent, and you can punch in a 9 code or a 10 code, and it will give you some recommendations from this tool developed by Medicare. This tool is also available on the Medicare website, and other folks might have it in their products as well, but we just wanted to make it easy for PracticeAdmin customers that if you're in Billing Manager, you're on the claim entry screen, and you have a 9 code, maybe on the encounter form, and it's not one that your practice hasn't already mapped to a 10 code, but you can look that up through the GEMS tool right in our product.
Great, and I'm glad we could show that. I think it's fascinating how you can see all the codes coming up there like that. I apologize, I'm learning to use this highlighter tool, but let's go ahead and jump into our questions. We're getting several questions in. This is from one of our customers on the West Coast. Eric, you want to jump into this? Is a big question, and I'm seeing it coming up several times now concerning the payers and testing.
Sure. So as the software company, We are testing with our clearinghouse partners. So, and just to remind everybody the process, you create a claim in our software. If it's a paper claim, you print it and you mail it to the payer. If it's a electronic claim, we create that for you. We send it to our clearinghouse partners. They then route it to the payers. So we don't connect directly to the payers, and therefore we're not testing, we as PracticeAdmin, directly with the payers. So the clearinghouse is doing that piece. And then the payers themselves, of course, are testing or doing the work inside their adjudication system. But the question we always get asked is, well, for a certain specific payer, should I be sending them 9 or 10? And we as PracticeAdmin, we don't know the official answer. The only person who knows that answer is the payer. So the payers have websites. The payers are sending out emails about when they're going to be ready. Medicare is, of course, saying for all dates of service after September 30th, send me ICD-10. All the other payers, ranging from large commercial payers to state Medicaids to the smaller payers, are all moving in that same direction, and there are various websites that list the status of various ones. We have some of those linked from our ICD-10 resource page at practiceadmin.com/ICD10. For example, just yesterday I saw an email, somebody put together a spreadsheet of state workers' comp programs and whether or not they were ready for ICD-10 or wanted ICD-10 codes when you file a workers' comp claim. I scanned through it and it looked like most of them, 75%, said they were just going to go with 10. Some were still, one of them said, I think it was Utah, said, we don't mandate this one way or the other. It's up to you and the individual payer who's handling this workers' comp claim to decide, which I thought was sort of kicking the can down the road a little bit. But the best answer we can give you is to check with the payer, because we want to make sure you get the right answer, and the right, most official answer is going to come from the payer themselves.
So this client then should go specifically to her specific commercial payers to see what their status is and what they're doing.
Right. So one of the things we recommend is for a practice is go look at your top 20 payers. You know, 80-20 rule, that probably accounts for 80% of your revenue. Go through those payers. If Medicare is one of them, well, you know that the answer to that, yes, starting October 1st. Then take the other 19 payers and just double check on their websites and see what they're saying about their readiness to accept ICD-10 codes.
Great.
The nice thing about our product, of course, is if they say, no, I don't want ICD-10, you can still submit ICD-9.
Now, a question that came in that might be related to this is how can we test claims before the deadline?
Well, one of the things the payers, of course, you shouldn't send a production claim to the payer using ICD-10 before they say they're ready. So if what the payers have done is they've each created test programs, and they've already selected participants for those programs, and they're already working with them. So if you're not already currently engaged with a payer, and there's at this point only 27 calendar days left, those programs are already underway. So the best thing you can do is just monitor that payer's website to see what they're saying about ICD-10. If they say they're not ready, you don't need to worry. You just keep submitting ICD-9 codes through our product.
Right. Let's move on to the next question. And this is one you've started to address some and that we're seeing a lot, is will we be sending ICD-9 and 10 claims simultaneously?
And the answer is yes and no. So yes, in the product, each claim you can individually designate, are you going to use the 9 codes or the 10 codes? So for your mix of payers, let's say you sit down on October 2nd and you're ready to enter in your encounters from October 1st. And so for each of those payers, yes, you'll have the ability to choose. So the product supports both 9 and 10. There was a related question that somebody asked about, well, should I just submit 2 claims, one with each version, and just that way the payer will at least pay one of them? And the answer is, we're not billers here at PracticeAdmin, but our gut feeling is that's not the right thing to do, and that you'll need to keep monitoring what the payers say on their website or on their IVR systems. And if you get a rejection back from one of the versions, then in our product you'll be able to pull up that same claim, switch the diagnosis choices to ICD-10. Let's say if you submitted a 9 claim and they rejected it for invalid diagnosis codes, and then submit it. If they reject it again and they said, oops, we're sorry, our system wasn't ready, you can switch back to the 9 codes. They'll still be saved in the product and hit resubmit again. But we wouldn't recommend creating 2 copies of the claim and sending them both just to see which one gets through.
Great, thank you, Eric. And we're getting similar questions to that. I'm just going to go ahead and read some of these out. They're similar to what you've been saying. For major medical insurance, like UHC and Anthem, do we know if they are ready to accept ICD-10 codes on October 2nd? And I know we've already addressed that, but again, let's remind people the situation for these payers, what they need to do.
Yes, so our understanding is that most major payers are ready, but any individual payer, and remember, payers gets complicated because Aetna owns Trustmark, which operates Starmark, and so, and because they acquired the Trustmark as a different company, they might still be on a different adjudication system. So our understanding is, yes, generally available, but any individual specific payer, your specific list of payers, the official answer has to come from that payer.
You'll have to go to the payer's website or contact them directly.
Right.
Okay, let's move on to the next. Again, are you expecting a delay in payment? And we know from experience that you do need to hope for the best, but prepare for the worst.
Exactly right, exactly right. As we saw, if there are folks on the phone who went through the 50-10 conversion, which has a 10 in the name, but isn't related to ICD-10, that was a change to the entire format of the message that we use, the message type that we use to send in these electronic claims, which was, when was that, Tamara?
Yeah.
3 years ago, right?
3 years
ago.
And you have to have 50-10 before you can move on to ICD-10.
Right, and so we did the 50-10 conversion to get ready in a sense for ICD-10. So what we saw during the 50-10 conversion was some confusion. Some payers said we're ready, and they said, oops, nope, just kidding, go back. And the issue I think with 50-10 for many practices was it wasn't something you could control. It's not a setting in the software. There was something happening behind the scenes. So what we kept having to do was saying, working with our clearinghouse, trying to get more information, and then saying, "Oop, we need you to rebuild these claims again," so they go back out because we're going to flip the format back the other way to try to get them through this payer. With ICD changes, this is actually something you can control in our product, which one you're sending out. So if a payer says, "Nope, that was the wrong one," you don't have to wait for us to do something. You'll be able to go in and change it and submit it.
Now, I was going to ask Kendra. Kendra's kind of on our front line here, talking to customers, if she has any suggestions or advice for our customers.
Let's see. Well, I know I've received questions about ICD-9 and ICD-10 on a single claim, and just know that you could only send one code set on a single claim. So just be mindful of that.
Yeah, so that's a restriction we had to put in the software because the electronic message format doesn't support a mix of those different codes in the same electronic claim file. So it's I guess on a paper claim you could use a typewriter and you could put whatever you wanted. You could put a mix of codes.
Right.
I don't think that would still be recommended, but yes, in our product, for any individual claim, you'll be able to choose one or more 9 codes or one or more 10 codes, but not a mix of the same at the same time on the same claim. As we mentioned.
Right.
Okay, the person who
otherwise it would have to be split.
Right. The person who's saying he was going to send both, would that potentially cause some denials and some problems?
Well, I think if you created, and Kendra, check me on this, if you create a claim for this one encounter and you submit it using ICD-9 codes, and then it hits release, and then you go ahead and create another claim for the same encounter, but just happen to use ICD-10 codes on this?
Yes, that's correct. You will be required to split that claim by the date to avoid mixing code versions.
Right. That's if you have it. Let's say a patient, who has, say, multiple encounters and one of them crosses, and those encounters cross over the midnight October 1st deadline, you would have to do that twice. But if you literally, just like if you created a duplicate claim today with different sets of ICD-9 codes for the same encounter, that's going to cause duplicate claim rejection.
Mm-hmm.
So,
yes.
Great. Let's move on to some of our next questions. From a customer, we received the question, we see very little Medicare or Medicaid. What slowdown do you expect for major medical?
Well, our experience with 5010 told us that actually Medicare seemed to be the most ready.
Mm-hmm.
The state Medicaids were challenged because they get generally limited funding from their state legislators. But major medical, so the large commercial payers, it was a mix. You know, some of them were ready to go, others weren't. So you know, it's one of the things we won't know till we know what it's like. I mean, it is, you know, for them this is a major change. Before, they were changing the format of the message they were receiving with 5010. Now all of their rules in their adjudication system that say these CPT codes are appropriate for this diagnosis, therefore reimburse at this rate. All those rules had to be rewritten, right? Because the computer now is seeing a different diagnosis code. Yeah. They're saying they're ready. You know, are they truly ready or not? I won't know. And one thing to talk about, in case you hadn't seen this news, and this applies to Medicare, although potentially other commercial payers will adopt this policy. Medicare, after some prodding from the American Medical Association, has agreed that for 1 year after this October 1st, if you submit a claim and the only thing wrong with it, that's important to underline that, the only thing wrong with it is that you didn't specify as specific of an ICD-10 code as you could have, but you were at least in the right family. So if it was a burn injury, you didn't check broken foot, but maybe you didn't get all the way down to burn injury on leg sustained while water skiing. So if the only thing wrong with the claim is that it's not as specific as it could be, but it is in the right family, they will pay it. They will not deny it for 1 year.
Right.
Now, there could be other things wrong with the claim, like if your rendering provider is not enrolled with Medicare or you left something else off the claim. They'll still deny it for those reasons, of course, as well. And they might report back to you that the ICD-10 code wasn't as specific as it could have been. But once you get everything else cleaned up, as long as you're in the right family of ICD-10 codes, they won't deny it. And
that gives you a little more time to really kind of prepare and learn the codes and how it's going to work, which will be nice.
It does. And everything I just said was sort of a one-paragraph letter from Medicare.
Right.
What that will mean actually in practice, we don't know till they start applying the policy.
They have not gotten very specific on that yet. No other announcements about that.
No. But I think the same thing we saw with 5010 is that if many claims across many payers are being held up, you know, what we saw with 5010 is everyone sort of reverted to crisis mode and said, well, let's just push these claims through, let's get them paid, and you know, or they relax their edits, you know, and you know, because I think, and I can't really speak on behalf of the payers, but my experience with them, they appreciate the fact that this affects your cash flow, this affects a practice or a billing company and your ability to pay your staff and to keep this whole engine chugging along. So they're not, you know, they're not just sitting thinking, good, ICD-10, we don't have to pay claims for like 90 days because, you know, they're going to be working hard to get any issues that do crop up resolved.
Right, but you did have some advice to the practices and to go ahead and close out by.
Sure. Right, that's one of the things we talked about in we had a general webinar about ICD-10 a couple weeks ago. One of the recommendations I've heard from billing company consultants and medical practices is if you have a backlog right now of claims waiting to be submitted, let's get those in because we know that claims with dates of service before October 1st require ICD-9. and you know those claims get paid. So if you should have a backlog, you just got claims you haven't gotten to yet, get those in, because obviously those will be the claims that you're being paid in October and November to keep that your regular cash flow coming in. And then starting October 1st, you'll be submitting claims to Medicare and presumably most other payers using ICD-10. And if there are issues with one or more of those payers, you want to make sure that you go in with a clean desk.
Get it done.
Get all your
claims. Get prepared.
Get it all done where you can. Right.
I have a question here, Eric, which kind of goes back to the beginning slide, kind of explaining a little bit about ICD-10 and the change. And she's asking, does ICD-10 change the modifiers we use to submit claims?
Oh, that's a good question.
Yeah.
I don't know the answer to that one. Kendra, do you?
No, I don't know.
Okay. What we'll do is we can explore that a little bit, and then I think it's Rhonda here is asking. We can get back to her. And
sure. Well, we also have in the upcoming webinars, particularly with Kathy Dyson next week, and then and then again in 3 weeks, both Kathy and I've forgotten the speaker's name. 3 weeks from now, Tamara, they're ICD-10 experts, and they would certainly be able to answer that question.
Yeah. And now we're going to open it up to any additional questions. We've received several, which have been really good. But if you have any other questions to ask at this time, please send them to us. I'm going through these.
While we're waiting, Tamara, let's talk about encounter forms.
Yes.
So, whether you're a customer or not, presumably you have an encounter form, also known as a super bill or a fee slip or a charge slip. On that encounter form, you have most likely your common ICD-9 codes. So on October 1st, when you're seeing patients, you need an encounter form that has ICD-10 codes on it. So don't wait until September 30th to redo your forms, just for your own sanity. But the other reason also is in our software, you can have your encounter form loaded in there, the image of your standard encounter form, and then using our schedule manager tool, you can print out encounter forms for all your appointments for the next day. So if all of our customers, if you all come in on the afternoon of September 30th saying, please update my encounter form, we're going to get a backlog there, a bottleneck. So what we've done is we've gone ahead and we've created a folder off to the side. So if you have a version of your encounter form with your ICD-10 codes on it, as soon as you have that done, go ahead and submit that into our support desk. We'll put that in that folder, and then late in the evening on September 30th, we'll copy those on top of your ICD-9 encounter forms.
Okay, so I think we've answered everybody's questions that have been submitted. So briefly, Eric, let's do a little plug for PracticeAdmin. I remind people they can call anytime for a live demo and actually see how that ICD-10 crosswalk tool works.
Sure. Yeah. So if you're not already a customer but you've joined our webinar anyway, and you like what you hear, we'd love for you to join the PracticeAdmin family. Just a little bit about us: we're focused 100% on the billing side. We don't provide EMR software, but what that means is, since we recognize medical practices need both, and you need information to flow between the two of them, we partner and integrate with top EHR systems. We have some preferred partners we're always happy to recommend, but we'll partner with almost anybody out there to do an integration. And our goal from day one has been to optimize the medical billing workflow, and that's what our software is designed to do, to get your claims submitted and get those payments posted and tracked when they come back in. And so that's why we're in business.
And again, a quick reminder, this webinar has been recorded, and we will have it available on our website for viewing. If you'd like a copy of the PowerPoint presentation, send an email to marketing@practiceadmin.com and we'll follow up with you. If you want more information about ICD-10, go to our ICD-10 resources page, and we have a link on here. Also, we have 4 more webinars lined up. Next week, we have Kathy Dyson from Dyson Consulting Services, and she will be speaking directly about how do you know if you're ready for ICD-10. And she is an industry expert and can help answer some of those questions that we were not able to answer. And again, we have other webinars lined up after that. Go to this link, PracticeAdmin Webinars, and you'll see our lineup, and you can register from there. Eric, thank you again for joining us today and going over and answering these questions. And Kendra, you too, thank you. Our EDI specialist over there, thanks for joining us today. And
Thank
again,
you.
go to our website for any additional information. Thank you, Eric. Have a good day.
Thank you all.
All right, Kendra, have a good day.
You too. Thank you.
All right.
Bye.